I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks.
It was their models that created the ability to see what these mitigations could do, how steeply they could depress the curve from that giant blue mountain down to that more stippled area. In their estimates, they had between 1.5 million and 2.2 million people in the United States succumbing to this virus without mitigation. Yet through their detailed studies and showing us what social distancing would do, what would happen if people stayed home, and it takes us to that stippled mountain that's much lower, a hill actually, down to 100 to 200,000 deaths, which is still way too much.
The virus, if left to its own devices, will do that dark curve that Dr. Birx showed you. The other dynamic force is what we are doing, what we're trying to do, and what we will do in the form of mitigation. We are really convinced that mitigation is going to be doing the trick for us.
Abbott Laboratory is actually going to be producing 50,000 tests a day and distributing those around America. There's already the machines in some 18,000 different locations around the country. And they've told us they have several thousand on the shelf now.
Right now, there's over 500,000 tests sitting, capacity, that are not being utilized. So we're trying to figure out how do we inform states about where these all are, how do we work through every laboratory association so they're aware, and how do we raise awareness so people know that there's point of care, there's Thermo Fisher, there's Abbott testing, and there's Roche. And if you add those together, that's millions of tests a week.
Were you surprised when you saw these projections? The numbers are sobering.
They're very sobering, yeah. When you see 100,000 people, that's at a minimum number. Now, what we're looking at, and as many people as we're talking about, whatever we can do under that number and substantially under that number, we've done that through really great mitigation. We've done that through a lot of very dedicated American people. The modeling that Dr. Birx showed predicts that number that you saw. We don't accept that number that's what's going to be. We're going to be doing everything we can to get it even significantly below that. If this is full mitigation and it's 100,000, why am I standing here saying I want to make it better? Because that's what the model tells you it's going to do. What we do is that every time we get more data, you feed it back in and relook at the model. Is the model really telling you what's actually going on? Models are as good as the assumptions you put into them. And as we get more data, then you put it in, and that might change.
This may be an uncomfortable question, but what would the models have looked like that Dr. Birx and Dr. Fauci showed us if we had started these social distancing guidelines sooner, in February or January?
China was heavily infected, and thousands of people were coming from China to the United States. And against the wishes, not even wishes, but they disagreed with the decision, I made a decision to stop China from coming in.
So we really can't answer your question until we can get antibody testing out there.
If there was no virus in the background, there was nothing to mitigate. If there was virus there that we didn't know about, then the answer to your question is probably yes. What Dr. Birx has said is that if there was covert infections here that we didn't know about and we didn't mitigate then they would have made a difference. If there was virtually nothing there, then there's nothing to mitigate. And I don't know the answer to your question.
Is there any fairness to the criticism that you may have lulled Americans into a false sense of security when you were saying things like it's going to go away?
Well, it is.
And that sort of thing. But
Jim, it's going away.
But when you were saying
it's going to go away, hopefully at the end of the month, and if not, it hopefully will be soon after that. And I hope we're going to be substantially under the numbers that you're looking at on the minimum side. Then I think we will have, hey, look, it's still tremendous death.
You weren't just hoping that it would dissipate, that this would disappear.
I want to be positive. I don't want to be negative. I'm a positive person. This is really easy to be negative about. But I want to give people hope, too. You know, I'm a cheerleader for the country. We're going through the worst thing that the country's probably ever seen. We lose more here, potentially, than you lose in world wars as a country. So there's nothing positive. There's nothing great about it. But I want to give people in this country hope.